Okay, so these drills are just return to running, so walk to run. So we're just going to do strike of hip, so nice raise there. So you don't want to see the athlete rocking back when they're driving up. Launch forward, catch on the other side. Works two ways, works on running form, and it also works on catching the landing. So it's starting to work into really modified plyometrics. So then the progression to this is trying to get more crispness in the hip drive. So knee drive up, knee drive down, and every movement is intent or purpose driven on speed and power and control. So when we start, we do control, then we do speed, then we do power, and then we try and progress that to being the control being the last thing, the speed being the key thing. All right, so these are front kick, so they're a good drill, especially if you're going to send someone back hurdling or jumping. So it's out, and then, so key there is to try and drive up onto the stance side calf. So do a calf raise at the end. So it's hip drive and then knee extension. That's it, good. So with anyone that's kicking a football, so an AFL player, for example, you'd want to see that improve so that they increase their hamstring or flexibility, increase hip range of motion, so they can get a better kick. You'll see athletes collapse onto their stance leg, and that's a good sign that they're still not as mobile as you want them through the hip joint. So that's a bit better there. So you're getting a nice knee extension. You can still see Rach, she sort of falls back a touch every now and again on the stance side. So you want to see them maintaining forward momentum going forward without any loss of spinal alignment. All right, now this one can be a little bit complex. So it's a Carioca done in a walking context. I like this because it just gets the athlete to start rotating or pivoting off their feet. So good to go back before running, just to tolerate that, make sure that they don't get any increase of pain, especially athletes with meniscus injuries post any knee reconstruction, mainly because that rotation can be the thing that really can drive their pain. So what we try and aim to do here is a nice fluent up and back each side. So you're trying to look for asymmetries in the way they step, in the way they move, in the way they cross their back foot over. So does the back foot go over as far as the other side? So they're the sort of things that you're looking for when you're doing this drill. So we'll let Rach come back again now. So you're looking for that left foot crossover there, and you can see that's relatively similar, which is good. Well done, Rachel.
Thank you.
So to work on some coordination, change the nature of a Carioca step to have the lead leg and hip, external hip rotation here, basically doing open the gate drill, shut the gate drill. So we just change the nature of the Carioca step, just challenges their coordination, trying to get that to be more fluent, that action, getting that external hip rotation to step away and to tolerate that balance and that rotation on the trailing leg there. Obviously when you're teaching new skills to people, it can be really challenging, especially in rehab, but the concept behind that is to try and improve their ability to learn whilst going through that rehabilitation stage. So Rachel's just learnt this now, so you probably see and maybe hear her, she's not quite sure, still trying to learn that activity, but still got really nice external hip rotation there in the way that she's pulling that leg around, and that's what you're looking for in that particular step. Okay. So these are straight leg marching. So purpose of this, going back to a walk to run context, is when you strike the ground, you want your hamstring to kick in. So you're not going to hyperextend that knee on landing with the ground. So you're looking for a really nice co-contraction. So the slapping on the ground is actually to stimulate that. So start that very softly, and you've got to be able to feel your hamstring kick in when you do that exercise. So it's like you imagine that when you contact the ground, the hamstring will hyperactivate, and that's what we want it to do to stop hyperextension of the knee when we go back and run. So this is a short pogo jump. So idea here is not to plantar flex your feet or your ankle, sorry. So that's good there. So it's nice and stiff. So if I put this camera angle down, you're not seeing the toes get pointed towards the ground. So that's indicating that you're using your feet, and that's the stiffness part of the exercise that you're after. Now you can do high pogos, which Rachel will do a couple, and you'll see the toes point and she'll bounce a lot higher. That's okay for power. When we start doing this, so really go back to short, 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 short like that. Okay, stop now. So then that short exercise there is all about developing stiffness and landing and reversing that force from landing to a concentric or a push force. It's giving a better perception of hitting the ground and then getting off the ground again. Try and build into more advanced plyometrics post knee injury, ankle injury.